Howdy YouTube family, it's Bolt SRNA coming to you again with another day's topic. I've got Dane Gaines here with me again. You can follow him over on Instagram at Dane_Gaines. And you can follow me over there too, it's Bolt SRNA. So today's topic is the 5 tips for success in CRNA school. So let's get into it.
All right, guys. I'm gonna start with the first one. Of course, you know we both experienced anesthesia school. We're about to graduate in a couple months, so we've been through it all. The main tip I would have for people that I would at least be sure to touch on would be, don't let other people's personalities get to you in clinical, because you're going into this situation, especially after the first year. If you're a front-loaded program, once you start clinical, you're going to experience a lot of personalities. There's going to be smart people. There are going to be people that like doing things their way. They may not work with students a lot sometimes.
Or they may not like to work with students.
Yeah.
You never know. You might be at a clinical site. I mean, you can't assume that every clinical site that requires the practitioners there to work with students, they may not like students. They may not want to work with students, but they're not going to, they're not going to rock the boat and tell administration they refuse students. But they may not particularly like it, or they may not be very suited to teach students. Yeah. And you will still have those people as preceptors, and they may let you know that they don't really like students, and they might say it to you, or they may just let you know through body language and through verbal stuff that they really don't want you with them for the day.
Yeah, you can tell. I would say you're going to go in and you may be at that same clinical site doing the same type of cases, and you may look like a rock star one day, and they tell you, man, you're doing awesome. I don't have any complaints or anything really to critique you on. Then you go in, you do the exact same thing the next day, and they may tell you that you're an idiot for doing it that way. And just don't let those things get to you, because it's a long road, and you just put your head down and push through it. And you walk out of there every day knowing that you did the best you could. And there's going to be ups and downs. Just keep going. That's my first tip would be, don't let that get to you as far as clinical. Focus on keeping your patient safe, do your work as far as researching the surgery. And some people, it's, I don't want to talk bad about anybody, but sometimes it seems like the people that aren't really well versed in different avenues of anesthesia, they aren't comfortable with doing things differently, so they want to do it their way because that's what they're used to. Typically the people you see are really awesome. You hear a lot of good things about. You could come in and they say, what's your anesthetic plan? Well, I'm going to do this, and this, and I'm going to run this drip and run a light on the gas or whatever, and they'll say, awesome, go for it, man. It sounds good. You know what you're doing. Some people say, I don't want to do it that way. I want to do this, and that. So don't take it personally.
Right. It a lot of times has to do with what they're comfortable doing. And it's funny, as we get closer to graduating and being CRNAs ourselves, and I think about what would I do in 6 months to a year if I have a student underneath me who's training with me, especially a newer student or a junior or a second year or something. How would I feel about that? And I realize there's a realness to, you have to know with your plan and how you do your anesthetic that you are going to be safe, that you are going to have the ability to rescue whatever the student may do that's not correct, or maybe they don't do it with much finesse or something, and you have to step in and fix it. Well, if you're not very comfortable with that type of anesthetic plan, you may not be that good at fixing the situation. So you may not feel comfortable telling a student, go ahead and do this plan that you want to do that I don't really have much experience doing, or maybe you only done it like that a few times. And it's your license and your responsibility to keep that patient safe when you have a student. So yeah, I mean, I get it. I understand where preceptors are coming from sometimes, physician anesthesiologists and CRNAs, their viewpoints. It's harder, especially as a second year when you're still newer to clinical and you're still not very good at many things, and it's easy to let things become personal. And you feel like their personality, that they personally don't like you and they're being mean to you or whatever. There's a lot of factors that play into it. And so it's good just to put tough skin on and just go in saying, I'm going to do the best I can do today. I'm going to learn whatever I'm bad at or good at or whatever. I'll just take their advice with a grain of salt, and I'll go into the next day trying to be even better than I was the day before.
Yeah, and it can wear on you over time, and knowing that you're in there as a role as a student. You're not a CRNA yet. You're not an employee there. You don't want to make waves. Somebody may come in and you just, they really may just have a bad attitude, but you can't say anything. They may say something rude to you, but you can't say anything.
You can't stand up for yourself.
Keep your mouth shut and just do your job, and realize that that's okay, and that's just part of it, and it's all going to be over one day, and you're going to be in their shoes. And don't be that preceptor after you get out and graduate. And if there are CRNAs or other anesthesia providers watching, take pride in knowing that you're teaching the future of the profession. Don't be somebody who's going to put negativity on these people, in a student role. Take pride in that.
Yeah. And if you ever are underneath us one day soon and precepting underneath us and we're coming off like a butthole to you, show us this video, remind us, and we'll apologize. All right, topic number 2, don't compare yourself to others. So that's a really important thing in CRNA school. As soon as you start your program, you're going to be sitting in a classroom full of maybe 30 other people. I think we had 29 in ours, and that's kind of a normal size for most doctoral anesthesia classes. And you're going to spend the next 3 years in class with these people. You're going to be in clinical class. You're going to do life together. You're going to do school together. You're going to go through a battle together pretty much, which is CRNA school, or a war, I should say. And so these people, you have a tendency to want to look at their strengths and what they're so good at, because all of you are impressive. I mean, all of you, to have gotten into CRNA school, you beat out many, many other also impressive people, and you were the most impressive to that admission committee at that program and said, we want you guys. So yeah, you're all of you are going to have some things that are going to be interesting or going to make other people feel insecure because they may not be able to do this, that, and the other, or they may not have as many strengths as you do. But all of us have our own strengths in our own way, and that's the reason we were chosen. That's the reason why we got admitted into CRNA school, because our admissions committees saw something in us that they said, you're somebody special, you're somebody that can make it and you can become a CRNA. So don't compare yourself to their qualities.
Yeah, you have the attributes that are needed to complete the program, otherwise you wouldn't be accepted. So focus on your strengths, make your weaknesses stronger, and like you said, don't compare yourself to other people. You're completely capable of completing these things and passing boards. Just put your mind to it. And that kind of leads us into the third tip, which is you're going to have to put in 110% of your effort and your time to this. Like, you are going to have to make this your life for 3 years if you're in a DNP program. It's going to be 36 months. You're going to have to realize that from the beginning. And our program kind of slowly tapered its way up to the second year. And then, you just get hit full-fledged. It's your life for the next 2 years. And you're in a different city every 2 months and a different hospital every 2 months. And you have to be prepared that that's going to happen.
Right. And so and even speaking, you said in the beginning, they kind of like work you up to it slowly. Your first year in a DNP program that's front loaded, which almost, at this point currently most programs are DNP already, and in the next couple of years they'll all be DNP or DNAP, and you'll have to be that to even practice as a CRNA as a new graduate. So we're speaking to you from our perspective in that sense. The first year is going to make or break you. That's when a lot of people fail out. We lost 4 people in our class, and it was during the first year because they struggle with the academics in the beginning because they hit you. I mean, when you start CRNA school, you've never done academics like this before. This is nothing like anything you've ever done in your undergrad. I don't care. I mean, I have friends that had an undergrad in chemistry and they did their BSN. I think you had an undergrad in biology as well. What did you have to say?
I had a bachelor's in criminal law. Criminal law,
yeah. And you were like computer tech and you were computer science before you went back for nursing. So even people who have like pretty widespread talents and abilities, they start CRNA school and they're shocked by the difficulty of the curriculum and how much of and that's part of the problem is the just tidal wave of content that just keeps coming at you and you try and memorize as much of it as you can as it's coming, but by the time you've gotten this material down, they've loaded 3 more things on top of you and you can't keep up. So you struggle a lot with that. If you don't dedicate 110% of your time, especially in the beginning, just getting down good study habits and time management and all these other things that you all know, it will snowball on top of you and you will never even make it to second year, which actually is even harder. Mm-hmm. But at that point, you're so used to carrying around this elephant that sits on your back all the time, you're able to handle it. But if you can't even get to that point, you'll be knocked out right before you even begin clinicals.
Just know that you can do it. I mean, you know, it is the hardest thing I've ever done, and I've done a lot of stuff. Yeah. I've done accelerated programs, you know, that were a year for my BSN, you know, and anesthesia school is the hardest thing I've ever done. And it's not only the academics, it's the lifestyle that you're going to have to prepare yourself to live. Mm-hmm. That's 24/7 anesthesia for 3 years. Yeah, you're going to have breaks here and there, and don't let that discourage you. You know, I love it. I'm glad I did this. You know, I don't have any regrets about making this decision, and I'm excited about graduating here in a couple months and going out and, you know, doing the job. But just realize it's tough, and you're getting a doctorate degree. After this, there's no higher level of education in this profession.
Forever. You never have to go back to school. There is no higher degree. Yeah. That's the best part about it.
They're teaching you everything that you can know, and that's what you're studying for. Mm-hmm. You're studying because you know what to do in a situation that you're going to be uncomfortable with you and your patient, not to pass a test.
Mm-hmm. Right. So you're studying for the patient's well-being in the future, not just so you can make that grade. All right. So topic number 4, don't be afraid to ask for help. So we talked about all the stressors of CRNA school, the 110% that you've got to give, the personalities in clinical that are going to stress you out and make you feel bad about yourself, mm-hmm. your other classmates who might make you feel inferior because they've got so many cool things going on or talents. So this is very critical, and this is going to help your mental health a lot throughout your 3 years of CRNA mm-hmm. school. Ask for help. Don't let yourself get to a point where you're falling into a deep, dark depression mm-hmm. and you're so overwhelmed from the stress that you don't even know why you're doing this anymore. You can't even imagine what would be so good about life, once you get out and stuff. You don't find the things that make you happy anymore happy. So don't let yourself get there. It's very easy to get to that place. And I would say every single one of us has been close to that place mm-hmm. where you're like, wow, I'm not in the right place that I want to be, like in my mind or in my life right now. And luckily most of us have coping mechanisms and healthy ways to handle the stress, and we try pull ourselves back out, and we call on each other for help. We call on each other, and we get strength from each other when we need it, or whether it be a counselor or one of your professors or whatever. It doesn't have to be your classmates, but just you have to have a network of people in your life that you can call on and say, like, hey, I'm having a terrible month, or I'm having a terrible year, or whatever it is. Like this, it seems like nothing is going right for me, and I'm just kind of unhappy, and I'm getting really down, and I'm just not myself anymore. And so it's a very real issue in CRNA school. And just don't let yourself get so far down that mindset that it feels like you're in a deep, dark hole and you can't get back out, and you might be thinking about suicide or other, really permanent solutions to a short-term problem.
Anesthesia is a stressful profession, even when you get out and you're doing the job and you're not in a student role where you kind of feel helpless a lot of times and you don't really have a voice. Don't, like you said, don't let it get so bad that you get to a point to where you can't really come back from it. And there's nothing wrong with asking for help. If it's with your academics, ask your classmates who may be strong in one area. That's the smart thing to do. If one of your classmates is a whiz at pharmacology, figure out how they study, work with them some, see if they can sit down on your study session or something, and learn what you can from them. That's we're all in this profession because we work together. We work together with other medical professionals, we work together with other anesthesia providers, the patient, and so it's something that you shouldn't feel bad doing, and it's actually a huge benefit. And the fifth tip for success in anesthesia school is try to focus on the positives of each day, especially when you're out doing clinicals and you're expected to perform and you're nervous, and you're not going to be able to get every intubation. You're not going to give the right amount of propofol every time. If you give them 200, you should have gave them 150, and the pressure tanks, and
it happens.
You're in the GI lab or something, you're trying to keep them breathing, and now you got up there doing a jaw thrust, and there's a scope down their throat and things like that.
Mm-hmm.
It's okay. Focus on the positives. Take something positive away from it. You learn from it. Maybe you got the intubation the second time or the first time, and go home and think about those things and how you're progressing in something that maybe you couldn't have done the week before. You had no experience in the week before.
Mm-hmm. Every time that you have something that happens that you're embarrassed about, or you feel like didn't go the way you wanted it to go, that is an opportunity for you to learn, and an opportunity for you to say, okay, well, that was not the way I wanted it to go. Mm-hmm. Tomorrow, it will go the way I wanted it to go. I am going to be better tomorrow, and you will, because you've learned a lesson. You've learned something from that. Don't ever let your failures just be failures. There are always opportunities for you to improve and grow and become better, and especially in the first maybe year of rotations, you're going to be all the time beating yourself up because of how you didn't do this right, or you can't do this, or you're so overwhelmed by the idea of being the only anesthesia provider in that room, thinking and doing everything that they're doing, because it seems like they have superpowers or something in the beginning, because they'll catch things and they'll change stuff on the vent, or they'll give a medicine, or they'll do a change or whatever, and you're standing there next to them like, how did you see that? Like, how did you anticipate that happening? And they're like, oh, you didn't see the circulator move like this, and the surgeon twitched their head like that, and the patient did a slight breath in like that, and you're like, no, I didn't
heard
see
this
all that.
Device out of, they're over there playing on their phone, and they hear something like, oh, you need to give some narcotic, because they hear a saw or something.
Yeah, and you're like, how did you do that?
You'll get there.
It's like superpowers they have, especially in the beginning. It's like they're superhuman, and you get so frustrated because you're all ICU nurses. You were all competent. I worked in the ICU for 4 years, and I took care of very sick, critical patients, and I worked all over the U.S. as a travel ICU nurse and lots of different places, and I was pretty confident in my abilities to monitor and to anticipate and to do stuff, but the anesthesia world is just very different. It's similar in the sense of like critical patients and ventilators and things like that, but the expectations and your abilities is just like extreme next level with anesthesia.
It's all on
ICU nursing.
It's all on you now. Like there's no one to call to say, hey, this is what's going on with the patient. What do you want to do? Mm-hmm. It's on you. You're the one in the room giving the drugs, giving the fluids, giving the blood, calling the shots about treating hemodynamics, and
you make all the decisions now, and there's a lot of responsibility with that. And in the beginning, you will be very upset by the fact that you cannot keep up with that. And as much as you want to keep up with it, you're just not going to be able to. Just now, towards the very end of your training, like we're in at the end of the third year, we're just now, I feel like, really able to manage most things fine without having to call anyone in the room to help us, to be able to run the case by ourselves, and to be pretty proficient and stuff. But it takes a long time and a lot of hours, a lot of hard work. So in the beginning, focus, and really the entire time, but especially in the beginning, focus on the positives that you do each day. Don't beat yourself up about the negatives. You will make mistakes. You will screw up. You will feel like an idiot. No one's expecting you to be a superhero here. They expect you to be a student and who's going to learn and who will make mistakes, but learn from those mistakes.
Learn to be comfortable with the uncomfortable, because you're going to be there a lot. That's going to be your environment for a long time. And you're going from being a very competent ICU nurse, a good ICU nurse, or you wouldn't have got accepted into anesthesia school, to the dumbest person in the room again as far as anesthesia providers. And it's difficult, but you got to learn to accept it as part of it. If you're a current anesthesia student, keep going. Don't let it discourage you. If you're looking into getting to CRNA school, definitely do it. I have no regrets, like I said, and it's completely doable, and it's very enjoyable through the whole, when it's all said and done, through the whole process.
So that's our 5 tips for being successful in CRNA school. I hope you guys liked it. You can go over to Instagram, like I said, and follow Dane Gaines over there, me, Bolt SRNA. Hit the like button if you like this kind of content, you like this video, and I'll know to keep doing stuff like this. Comment down below if you have any questions or comments about these tips, or if you have any tips yourself. If you're in anesthesia school and you want to tell us, what makes you successful in CRNA school. I think everyone would love to see it. And otherwise, that's Bolt out.